The question of COVID-19 reinfection is under investigation in South Korea. The country has reported 116 fresh cases of recovered coronavirus patients testing positive for a second time. These cases are raising concerns about whether authorities will ever be able to eradicate the virus. Korea's Center for Disease Control says it's a case of the virus being reactivated rather than reinfection. Other experts suggest faulty tests might be to blame, or that patients may still harbor low levels of the virus even after they've recovered. With case numbers on the decline, more people in South Korea have been flouting safe distancing guidelines. The government is set to discuss relaxing restrictions later this week, but has cautioned that easing measures too early could result in another wave of infections. Dr. Leong Honam from the Ropi Clinic at Mount Elizabeth Novena Specialist Center joins us for more on this. Dr. Leong, what would explain Japan's latest surge in cases? Is it accurate to say this is a second wave of infections?
I would say so. But if you really think about it, I'm a little bit surprised that Japan lost it with large numbers. If there's any nation with a culture of ingrained mask wearing and being disciplined about when you're sick not to go out, it would be Japan. And they will yet be the number. In this case, their numbers are rising, telling that it is something beyond wearing masks. But if you look into the culture of the Japanese, they are very hard workers, which means that if they are feeling unwell, mild illness, they'll still go into work. I think this may be detrimental to the control of the virus. And this thing is, there are reports of people coming in and not being very restrictive and not being strict about controlling of movements out in the public. What it means is you might have a mild illness, you are shedding the virus, and then in turn when you go out, you spread it on to other people. So there's not enough emergency strict measures to control the virus transmission out in the community. Lastly, we are hearing reports of asymptomatic individuals who can actually have lots of virus in the nose. And there's a report that's published from China saying one such individual, asymptomatic, they went on to spread to 11 other people whom he came close in contact with. So these are things which the Japanese culture wouldn't recognize because they feel well, they wouldn't wear a mask, and they'll go out and then in turn spread to other people.
So, Dr. Leong, what's it going to take then to bring down the infection rate in Japan? Are tougher restrictions then needed in this instance?
It would be. We have to take a leaf from the Chinese. The Wuhan city actually demonstrated the recipe to it. In essence, you would actually have to close down, lock down, severely restrict the number of people who can go out to do their marketing, to buy their things, etc. And this would actually put a dampener on the virus. Remember that the virus, after acquiring into a person, has a time limit. In about 3 to 4 weeks, it has to pass on to another person. If it fails to do so, it will die within the person. So if we observe this, the time limit of 3 to 4 weeks, and do not allow the virus to pass on to anyone, we will actually break the cycle of transmission.
Well, some countries, including Spain and India, are planning to partially reopen their economies. The WHO has warned that a resurgence of the virus could come back if the lockdown is lifted too early. From what you're saying there, then it would be a bad idea then for them to sort of reopen, and they should remain closed until the virus is sort of eradicated.
Spot on. If you can actually start looking at the Chinese are ahead of us in terms of the epidemic cycle. As they opened up, you are getting more and more cases coming in. And again, these are the travelers that are bringing the cases. Now, bring in mind that there are asymptomatic transmitters or pre-symptomatic transmitters. You have the perfect recipe for the perfect storm. A traveler could come in, sneak past, not be detected, and spread on cases within the country. So all countries need to be very careful, especially foreigners coming into your own country. It might be helped if the country is an island on its own. The sea will provide a barrier in the form of restriction. But if you're land connected with someone else, then you might be at even greater risk.
All right, but let's look at this lockdown. How hard is it to get people to actually stick to just lockdown measures and even restrictions as the weeks go by? Is there going to be shutdown fatigue, so to speak?
Absolutely. I myself was locked down for 21 days in 2003 when I fell sick with a SARS virus. And I was really growing crazy by day 14 to day 17. So I don't expect this piece, it won't be a piece of cake. It's going to be really tough to get people to lock themselves in and not go out. Even with modern amenities, with a handphone, with streaming videos and whatnot, people get tired and it's very, very frustrating. I think it's very challenging, but the will of the people will determine how successful we are in eradicating the virus. And mind you, the effort is not just our country alone, but the whole world. As Steve has correctly pointed out, if the rest of the world is still shedding the virus, all of us are still at risk.
Dr. Leong, just one last quick question before we let you go. Here in Singapore, we're under sort of these circuit breaker measures at the moment, but many people are still wanting to go out and to exercise. Is that a concern for you? You're talking about sort of shedding of the virus and possible pre-symptomatic or people that aren't showing signs. Is that something we should be concerned about and trying to not do?
Yes, absolutely. I understand the need to go out. We still need to buy our marketing, etc. You must obey the physical distancing. The government has talked about the 1 meter distance. My challenge to the audience is 2 meter distance. Keep 2 meter distance away. Number two, if you understand that people are asymptomatic transmitters, that means the person in front of you, next to you, may be shedding virus and you do not know. You may keep the distance away from him, but he may come close to you because he doesn't have the right mind to think. Then what do? You wear a mask. When you wear a mask and he wears a mask, even though we are shedders or he's a shedder, I can't pass to other people and I can't breathe in the infection. Only then will we have a near watertight solution in preventing transmission. Physical distancing, I prefer 2 meters to 1 meter, and wearing a mask every time you leave the house. Without the mask, you are in danger.
Okay, thanks so much for sharing your thoughts with us this evening, as always. Dr. Leong Ho Nam from the Rofi Clinic at Mount Elizabeth Novena Specialist Centre.